if I tell you that I have a lot of pain right now, and I have like this my cheek, and then somebody tells me you probably had a really bad infection, and then I go to the dentist and the dentist said you have a horrible acute infection. What is the meaning of that? Well, the meaning is this is the coronal part, this is the apical part of the roots. Remember, we call it apical, you can call it the tip of the root, but when the infection gets in, like in this tooth, what is going to happen? The infection travels all the way inside the vascular system, and then it goes all the way. And what happens when this is infected to that point? It can give you fever, it can give you headache, it can give you discomfort to the point that unless the infection that you have in, like we're gonna see it in this presentation today, you cannot tolerate the amount of infection is there. That can go to the spaces of your brain, and we have another episode about infections that can go to your brain and create a septic shock, and you can die because the infection wasn't treated correctly. Well, that's how I saw the patient. Sometimes they don't have any pain, because in this case, the fistula of this patient that you see here, there is this round little circle is where you can say the infection at the end of the root, or you can say, well, what is the root? This is the crown. See like a little frame. That's the crown, and then you see like some legs around. These legs are the roots, and around it is where you can see that you have an infection. And how do you know? Because it's darker the color, and the bacteria destroy the bone, and then when they destroy the bone, then create a space, and that space is populated by bacteria, and the bone is gone. So that's how we differentiate infections in the x-rays. So I tell you this because this patient, when he was here, the infection was worse than you can see it here. I start his draining by doing a small incision, and all the pus came out, and I get so excited when the pus comes out because I know the patient is going to heal. And before I do anything, I go again to all the diagnosis, medical history, blood pressure, how the patient feels, check if the patient doesn't have any oral cancer inside the mouth. All of that have to be done by your dentist or endodontist. And to confirm the fistula where he was having the abscess was coming from the correct area, I put a radiopaque material that you can go through this all the way, and it will tell you where the infection is. And after that, after we treated the patient, he comes regularly to be treated, then we can see that the patient infection start healing. We have only 2 years of follow-up. I have a couple of more because I get impressed when a root canal treatment stays in the mouth for more than 5 years, 10 years. Of course, the success is going to depend if you grind your teeth, if you wear a night gown, if your crown was done correctly. But when the crown was done correctly and your root canal, but if you don't brush and floss every single night at least, nothing is going to work because the bacteria are going to start attacking. Even they go underneath the crown and start affecting the root canal that you have already done. So just think about how much money you spend during the root canal, the time in the chair, the discomfort, and the need to have heavy antibiotics when you can avoid all that through brushing and flossing. And if you are not close to a doctor and you don't want to risk your life, what I'm going to advise you to do is really go to the store or try to grab something like, like a little needle, pinch yourself and let the pus come out, because these infections are extremely dangerous. And when you go to your dentist, they're going to clear your infection. And usually in these situations, I bring my patients 2 times and I let the infection to drain. Like one of our great teachers, John Stropko, said, the second appointment is the last chance that we have to clean completely the root canal treatment. I hope you like the episode. If you have any questions, let me know. Or if it happens that, if this has happened to you and what happened, I can hear your story and I can answer. Thank you.